Savannah. How are you today?
Good. How are you, Heidi?
Good. Well, I'm giving you a report on our patient.
Okay.
She's a 28-year-old female. Her name is Miss J. She is 1 day post-op for a right knee arthroplasty. She had a Foley, but it was taken out an hour ago, so she'll be due to void at 12.
Okay.
Her last bowel movement was April 11th, so 2 days ago. She has been experiencing pain at a level of 7. However, we did give her oxycodone about an hour ago, so now her pain is down to a 4.
Okay, good.
She is saline left, the left antecubital, 20 gauge, and she is 1 assist with a front wheel walker. Other than her pain, she seems to be doing well.
Okay.
Okay?
Thank you.
You're welcome.
Now the nurse is going to do her initial contact. She's going to knock, wash hands, introduce herself, identify the patient, and assess orientation.
Hi, I'm Savannah. I'm gonna be your nurse today. Can I see your armband? Can you tell me your name and your date of birth?
My name is Joyce. Awuah. Date of birth 02/07/1981.
Okay. And can you tell me what day it is?
Today is Tuesday.
Tuesday. And can you tell me where you are?
I'm at the hospital.
At the hospital. And what brought you here today?
My knee.
Your knee?
Yeah, I had a knee surgery.
Knee surgery. Okay. And on a pain scale of 0 to 10, can you tell me what your pain is?
4.
A 4. And what makes it better or worse? Are you using ice?
Yeah,
Maybe.
ice. The nurse put some ice in it.
Okay. And is it just in your knee or anywhere else?
Just my knee.
Just your knee. And can you tell me, describe it, is it a aching, a dull, or discomfort?
Discomfort a little bit, but not too much.
Okay. And can you tell me any allergies that you have?
No, I don't have any allergies.
No allergies. Okay.
Now the nurse is going to assess the vitals.
All right. I'm just going to get your vital signs if you don't mind. I'm going to check your blood pressure. Okay, that's good. And I would also check your pulse and your oxygen saturation. And that looks good. And can I get your temperature? Okay, perfect.
Okay, now nurse is going to check the head. She's checking for bruising, pain, tenderness, lacerations, and abrasions. She'll also be checking the cranial nerve number 5.
All right, Miss Joyce, I'm just going to check your head. Have you had any falls recently?
No,
Any pain or swelling in your head that you know of?
no.
All right. Just going to put my hands in your head if you don't mind. And tell me if you feel any pain. Any pain?
No.
All right. Pause it. Okay, Joyce, I'm going to rub an object across your face, and can you tell me if you feel that it's sharp or dull?
Okay.
Can you close your eyes for me? Okay, and just tell me if you feel it sharp or dull.
Sharp.
Okay,
Sharp.
perfect. And I'm also going to check your sinuses and just tell me if you feel any pressure. Have you had any trouble with your sinuses?
No.
And I'm just checking your lymph nodes. Tell me if you feel any tenderness. Any tenderness or pain?
No.
Okay, perfect.
Now the nurse is going to check the eyes. She's going to check perla, extraocular movement, the conjunctiva, the nerves 3, 4, and 6 via the cardinal fields of vision, and optic nerve number 2 via visual field of acuity.
All right, can you look straight ahead at that wall for me? And then straight ahead at the wall. And then look at my pen. And then just follow my pen all the way to you. Perfect. Okay. And then look straight ahead again. And this is where I would dim the lights. And just look straight ahead for me. Okay. And one more time, I'm going to shine a bright light in your eyes. Perfect. All right. Now just look straight at my pen and follow the pen with your eyes. Okay, and now I'm going to move my pen, and can you tell me when you see it, okay? Tell me when you see it.
See.
Okay, one more time.
See.
Okay, perfect. And I'm also going to rub this cotton ball across your eyes as well. Just keep your eyes open, okay? Just checking your response. Perfect. And do you wear any glasses or contact lenses?
No.
No. Okay, perfect.
Now the nurse is going to check cranial nerve 8. Also the ears, any drainage, pain, surgery, or hearing aids.
All right. Joyce, do you wear any hearing aids, or have you had any trouble hearing recently?
No.
No? Okay, I'm just going to take a look. Okay. Any pain around your ears?
No.
Okay. Now, I'm going to get you to see if you can tell me when you can hear this sound, okay?
Here.
Okay.
Here.
Perfect.
Now the nurse is going to check the nose. She's also going to check cranial nerve number 1. She'll be looking for deformity, drainage, surgery, and the ability to breathe.
All right, now I'm just going to check your nose. I'm going to check this line in your nose. Have you had any recent drainage, any nose surgery,
No.
problem breathing? Okay, can you breathe in for me? And breathe in for me? Perfect. And I'm just going to get you to smell this and tell me what you think this smells like, okay?
This smells like coffee.
Perfect. Thank you.
Now the nurse is going to check the mouth. She'll be checking for cranial nerve number 7 to see if Bell's palsy has occurred, cranial nerve 9, and cranial nerve 12. She'll also be looking for denture, sores, mucous membranes, or obstruction.
All right, can you open your mouth wide for me? Do you wear any dentures or partials?
No.
No? Okay, can you stick out your tongue like this for me? And move it sideways. And the other way. Perfect. And move it up like this. Perfect. And have you had any recent mouth surgery?
No.
Okay, and can you smile for me? Perfect. Beautiful smile.
Thank you.
And also, can you take a swallow of this for me? Or you can eat it. You got it. Perfect. Any trouble swallowing?
No.
Okay.
The nurse will check the neck. She'll check the trachea, the carotid pulses, and she'll look for JVD.
Can you turn your head to the left for me? Okay. Now I'm just going to check your pulse. Okay.
The nurse will now check the chest. She'll be looking for the breath sounds and the heart sounds.
All right. I'm just going to check your heart and lung sounds, okay?
Aortic, pulmonic, herbs, tricuspid,
I'm going to lift you up just a little bit, okay?
and mitral. She'll also be listening for a full minute for the apical pulse.
Okay. Now I'm just going to check your lung sounds, and every time I move my stethoscope, can you take a deep breath in and out for me?
Okay.
Two more. Perfect.
The nurse will be checking the GI and the GU next. She'll be inspecting, auscultating, palpating, and percussing. She'll also be asking questions about frequency of defecation and urination, as well as nausea, vomiting, weight loss, or gain.
Okay, I'm just going to look at your abdomen. Have you had any recent weight gain or weight loss?
No.
Now, can you tell me when your last bowel movement was?
was yesterday.
Yesterday, and how frequently do you go at home?
Once a day.
Once a day, and can you tell me what it looked like?
It's
Was it
soft, it's not hard.
soft? Okay, I'm just gonna listen. Okay. And I'm gonna press on your stomach, so just tell me if you feel any pain or tenderness.
Okay.
Okay. Okay. And when was the last time you voided?
This morning.
This morning. And are you having any painful urination? Anything?
No.
No. And are you sexually active?
Yes.
And what are you using for protection or birth control?
I use condom with my husband.
With your husband? Okay.
Apple, that's my husband.
Okay.
The nurse would also check the catheter if one was present.
And we took your Foley out, so you'll be due to void in about 6 hours. So just whenever you need to go, just call us and let us know.
Thank you.
The nurse will check the upper extremities. She'll inspect and look for abrasions, lacerations, turgor, tenderness, in both the radial and brachial pulses. Also, cap refill, range of motion, and grip strength.
Okay. And can you raise your arms all the way up for me?
Right now she is
Now.
checking for cranial nerve
Elbow.
11.
Okay, and back down. And then shrug your shoulders up and down like this. Perfect. Okay. Okay.
At this point, she will ask about a self-breast exam.
Do you do a self-breast exam at home?
Once a while.
Once in a while? Okay, so we really like you to do them once a month, and typically the same time every month. And after your period is best, just because you're less tender. Can you show me how you do yours?
Okay. I always stand from here. And then I this way around, all the way around. Like this.
Okay.
So I cover the entire breast. That's
Okay.
how I do it.
And make sure also whenever you do that, also go all the way up here. It's called the tail of Spence. There's still some lymph nodes up here, so make sure you're going up there as well.
Okay.
And then squeeze the nipple too to see if there's any discharge.
Like this.
Mm-hmm.
Okay.
Perfect. And also, you can put your arms like this and bend over in the mirror and check and see if they're symmetrical. And you can also raise them up and check and see if everything is symmetrical as well.
Okay. Thank you.
The nurse will now check the lower extremities. She will look for abrasions, lacerations, and bruising, tenderness or edema, cap refill, and she'll also be looking for the pulses.
Just checking your pulses. And whenever you need to get up and walk, just make sure that somebody's in here with you. And do you have any pain or tenderness under here?
No.
No? Okay. What about under this one?
No.
No? Okay. And your bandage looks good. Right. Can you bend this knee up for me? Perfect. I'm just checking your pulse. And do you use any assistive devices at home?
I use walker.
A walker?
Mm-hmm.
Every day?
Yes.
Okay. And can you pull on my feet? Pull on my hands? Uh-huh. And push. Perfect. Okay.
The nurse
And I'm going to also check your femoral pulse. Perfect.
The nurse will now check the IV to see if it is clean and dry and intact and infusing.
All right. Can I check your IV? Are you having any pain or tenderness around your IV site?
No.
No? Okay. And it's still going. Okay, they'll probably be taking that out sometime today.
Okay.
The nurse will now get the breath sounds she did not get on the back.
All right, I'm going to have you roll over. I'm also going to assess your back.
Can you hold my leg?
Yes. Ready?
Mm-hmm.
Just like that.
Thank you.
Just assessing your back. Okay. And checking the heels. Perfect. And roll back one more time. I'm going to sit your head up so we can get your lung sounds on the back, if you don't mind.
Thank you.
And just whenever I move my stethoscope, just breathe deep in and out. Last two. Okay, perfect. Can lay back down. Okay.
The nurse has now finished her full body assessment. She will situate her patient and then go document.
Can I get you anything before I leave? Can I bring you anything?
No, I'm good.
Okay. And here's your call bell, so whenever you need to get up or whenever you need to use the restroom, just call one of us in here so we can help you walk, okay?
Okay.